Nice to see you all. So we are in the breakout room to talk about social isolation, loneliness and community involvement. And we've got a group of panel experts that are going to talk to us a little bit today. But we really want to make this as interactive as possible. So please use the chat function to ask any questions. And people have already sent questions in advance, which is great. We also have interpreters. So if you do need an interpreter, please use the search function to find an interpreter, one or two. I was going to start by inviting Anna and Nicola to share some of their experiences around social isolation, loneliness, and community involvement. Are you in the room, Anna and Nicola?
Yes.
Brilliant. Over to yourselves.
I think Anna is going first.
Great. Anna, do we have you here? You might be on mute.
Yeah, sorry. I didn't find the button to unmute, but I already did. Yeah. So thank you all very much. I'm very excited to be here. My name is Ana. I am Colombian. And every time I can mention my community, the Latin American community in London, I do. So thank you for this space. I collaborate with Empoderando Familias, an active network of Latin American parents striving for a greater understanding of the English education system so they can better support and guide their children. And before lockdown, we met every 4 weeks in addition, and to the session, of course, we share some time together and we just spent a lovely morning together. But when lockdown started, as a group, of course, we faced a very difficult decision of what to do. As you'll know, meeting was no longer an option to meet in the same place. Yet, as a group, we decided to keep going, and we trained ourselves and taught each other how to use and connect on Zoom. And of course, we are living in very strange and scary times, and we can choose to stay nostalgic, of face-to-face encounters, or we can choose to use digital tools to our benefit. And as a group, we decided to take advantage and we strengthen our community. We continue to work regardless of distance, connecting our ideas, recognizing ourselves digitally, which is another experience, and just using digital to our advantage in favor of our project and of course our children. And during the lockdown, we met every week. And although digital can never equal the experience of being face-to-face, as a group, we explored together this great possibility and just supported each other week after week during these very challenging times. So that was my story, and I jump to Nicola.
Nicola, are you able to unmute yourself?
Right, here we go. Yes, I shall keep this short. I'm working with a group of patients in our primary care network, the Brixton and Clapham Park Primary Care Network. And I was going to bring you two stories, not of the crises we've heard about, but two people who have lower level mental health issues who've been living with them. One is a lady called Iris, who's 83, whose mental health issues improved incredibly when she moved into a local care home and had communal meals, and 3 local organisations got involved with her, and she went for coffee mornings, for lunch sessions and for music evenings. She was a pianist all her life. She has found lockdown has just reversed her whole life and well-being. She tells me that she feels she is in prison. They're not allowed to have communal meals anymore in her home. She has them delivered to her door. She tells me she's even stopped playing the piano because she is so unhappy. Of course, this is also about the digital divide, because she can't join in with local activities because she has nothing except a landline. So for her, life has got immeasurably worse, and clearly will be doing so in the second lockdown. The other person is called Iris. She is younger. She has had very low level mental health issues, but she's always seen the surgery as the backup. When her pills run out, she goes in there for help with getting repeat prescriptions, or when she's feeling worse, the receptionists know her well and help her stay on the straight and narrow. She turned up after lockdown and saw this big black and yellow notice on the door saying the surgery is shut. She was so shocked. She didn't read the small print, which explained how she could get in touch with the surgery. She tells me she just collapsed on the floor crying. Unfortunately, some other patient came along and took her to the nearby pharmacy, who sat her down and helped her. But again, she feels her lifeline has gone with the surgery. We in the PPG have been supporting her, and we fed back stories to the surgery, who have now changed the notice on the front door and changed the notice on their telephone calls. So I'm just saying really that bringing the support of a community around people who are feeling isolated can make a big difference. And this is something I think we're going to be doing together. Thank you.
Nicola, Anna, thank you so much for sharing your story with us. And I think many people are impacted by what's happened at the moment. And we know social isolation and loneliness is definitely a cause for concern. I was going to now invite some of my colleagues who will be on the panel. Millie Banerjee, who's the chair of the Integrated Care System for South West London, Matthew Traynor, the chief executive of Oxleas, Dr. Emily Finch, clinical director at SLAM, Al Beck, who's head of psychology and psychotherapy at SLAM, and Jessica Mukherjee from Public Health Kent. And we're joined by Falaki Segun, who's Healthwatch lead across South East London. I was going to invite Emily first, if I can, just to explain a little bit about the ambition that the Taskforce has created for this area. Do you want to just talk a little bit about that ambition and why you've arrived at that with the support of the Taskforce?
Yeah, we've been going through some really interesting discussions since the last Taskforce about the last summit, to try and refine our ideas and ensure that we take forward actions that are going to be really meaningful. And myself and the colleagues I have on the group, of which Ranji's just talked about them, have come up with the following, and something we're very pleased to continue discussing and to listen to people and see whether we're on the right track and whether we're doing the right things. We were asked to look at social isolation, loneliness and community involvement. And we are very keen to build on the listening campaign that we've got. I mean, both Nicola and Anna have just talked about very different people with very different needs, some of which are much more practical than others. And we think it's really important that we engage with a whole range of community members so that we can take forward the diverse needs that people have. So we're very keen to listen to the listening campaign. We want to make sure that we can connect people with existing networks. So some of the things that Nicola talked about, you know, Nicola's part of PPG in Brixton, those exist. People don't know they exist. People can be supported by them once they do. We also want to assist with helping people set up networks where they can with grassroots support. And where we're particularly aware, we're all very much aware, and we've discussed extensively in this group about this whole issue very broadly of digital exclusion and how to help people in the communities overcome that barrier, either by becoming more digitally skilled themselves, and or alternatively by just making sure that we can bypass that digital wall for people. We've created some ideas. One is that we're very keen to listen to our communities and deliver a programme of mental health awareness. And also we've come up we were very thoughtful and thinking about the idea of mental health champions. So groups of people who've had lived experience of mental health, who can talk to other members of the community who may be at risk of it. And again, as I mentioned before, we're also very keen to support people who are digitally isolated by helping them get online and that they can connect with local groups that can help them. And I'm increasingly aware that this issue of digital exclusion is a very complex one, and it has very many different manifestations for different people. And there has to be a whole range of sensitive solutions that will help people. So Ranjit, that's rough summary of what we did. Shall we ask some of the other members of the group to comment?
Yeah, that's really helpful. Thank you very much for that. I was just going to bring in Jessica, if you wanted to add anything to that. Jessica, you might be on mute.
Yes, I'm just unmuting.
Ah, there you go. Yeah, brilliant.
Yes, I mean, I think the critical thing for public health, and I'm here very much as a public health person, that, you know, in response to this pandemic, we know that, you know, social isolation, you know, contributes to coronary heart disease, it contributes to mental health, mental illness. And, you know, the lockdown upon lockdown, you know, it's going to take its toll. So, you know, we're really, really keen that one of the protective factors to social isolation is being involved, and community involvement's just so important. It's part of being a protective mental health itself, but also empowerment as well. So holding us to account. So I think what Emily was saying, that, you know, we want to listen. We want, you know, you to be involved, because, you know, not just because it's a good idea in any way, but it's actually good mental health, good public mental health.
Thank you very much for that, Jessica. Really appreciate that. And I know that many others were involved, but I'll turn to those colleagues in a second. And I think I'm just going to invite people who are watching to please put any questions in the chat function, and we really need your contributions to be able to make this a success. So I was just going to bring in Millie Banerjee, if I could, Millie, to ask you about your views in terms of the work that you do across South West London with the integrated care system, about the work around social isolation, loneliness, and community involvement, and how this ambition has spoken to yourself.
Yeah, let me start from the sort of strategy place. We have very much identified that the community provision for mental health support needs to be enhanced. For the reasons that we've already heard, is that the demand is going to be quite different from what it was before, not just in volume, as our colleague from Centre for Mental Health said, but also in terms of the different cohorts of populations that will be engaged. So we're doing a piece of work which is around actually understanding the environment, is what is there, what is available at the moment, so that we can focus in on the gaps. And it's a little bit early to give you a definitive response, but I'm very pleased to hear about the task force putting in ideas. But it is clear that loneliness is a big issue, particularly as we are now even in a second lockdown, and who knows, we might be in a different one. And that loneliness actually is manifesting itself in a very different way. At one end of the scale, there are the elderly, lonely people who are lonely anyway, but they do get the occasional visits, which they are not getting now for obvious reasons. But there's also loneliness within the family, because we are seeing evidence where, although you're at home all together in the family, there is kind of loneliness that individuals are expressing and being seen to be part of, because you're not getting the ability to go out and, you know, mix with other people that you would normally do. These are very sensitive issues. So I think, Ranjit, the early indications are, and it's not going to be rocket science, is it? We've already mentioned that. The early indications are that we very much need to engage at a kind of a micro level, at the very local community level. We also, I personally think we need to not just use the networks that are available, but try set up different networks. And I know that's very difficult to do. And different new networks have a sort of a sustainability risk because they can be set up and then they, can't be kept going. But it does seem to me, for instance, looking at a parallel example of food provision, which was very much a lot of restaurants sort of contributed to that, and they set up networks. Whether we can, in the mental health community support environment, can engage with retail people who are already open, including pharmacies, healthcare retail people who are open and who continue to open. And we do go to pharmacies to get our medication and to get medication for our loved ones. Whether we should concentrate a piece of work on that kind of sector. So we already know that, about the local implication of it, and those were two examples. The other thing I think what we need to do is to prepare for the wave as it comes through. And I think what one of the things that we will be doing, and this is all in the thinking stage at the moment, is engage GPs in order that they can be alert to these kind of symptoms, which may come in as physical symptoms, but may well be mental health issues as well underlying that. And that, I think, is something we need to build into the kind of post-lockdown and post-COVID era if we're getting to that. The last point I wanted to make, Ranjit, is to working with local authority colleagues, because they know more than anybody else what's going on. They know much more than their healthcare colleagues. So I don't know if Ruth has managed to get on the line yet, Ruth Dombey, who's the leader of Sutton, but she is helping us. We're working with her on the issue of collective trauma. And collective trauma is something that previously has been experienced in earthquake zones, post-war zones. It's a kind of PTSD. So we are planning a workshop with people who are experts at collective trauma, in order that A, we understand the diagnostics, what is it that we're watching for, and B, we start to implement across the ICS the interventions that might be the most helpful ones. So it is very much work in progress, Ranjit. Our colleagues will realize that. But as you know, certainly from Southwest London and from me personally, I have a huge drive to actually address these issues.
Fantastic, thank you very much, Millie. And I think absolutely we commend that drive and very grateful for your ongoing support. Can I just check, is Matthew Traynor on the line? And if you are Matthew, do you have a view? I couldn't see, but some people sometimes arrive under other people's names.
I don't think he's in the room yet, Ranjit.
Oh, okay, sure. No problem at all. I might come then in terms to ask, so we're getting lots of questions coming through, but they're not going to everybody for some reason. They're going to the host in some ways. But what we're seeing is some really positive work that's happening across the system. So what we will do is share what we've heard today with everybody who's attended, so that we can make sure there's some fantastic work happening in Richmond with 1,600 people who've been involved in talking about loneliness and isolation. There's some reports being produced, so we'll make sure that gets shared. Falake, I wanted to ask you a question, really, if I can, which is, how do we bridge the gap around reaching out to our community at a time when we are in lockdown and we're having to rely more on digital? Is there something that you have learned in your work at Healthwatch or in the recent times since COVID that you think that we could learn from?
Well, okay, that's a good question. I think you're right. It has become more and more difficult for people to engage now that we don't have the opportunity to meet the way we used to meet. And so people are having to be cleverer or to identify different tools Nicola is still able through the PPG network, for example, to meet up with people regularly in small groups. I know now that we're in the second wave of the lockdown, it becomes even harder. So those groups of 6 might not necessarily work in the way that they did beforehand. I think one of the things that we can look at, and I think Millie alluded to this, is some of the mutual aid groups and the way they worked during the first lockdown. This is an opportunity, once again, to connect with groups like that. And in some neighborhoods and communities, I live in a very caring and supportive one. And so it is about being kind and knocking on neighbors' doors and checking with people as well to see if support can be provided, if you can help in any way. I think one of the things that communities can do in a sense to support activity and services is to actually talk, and it's to talk about the experiences and talk about the learning, and in many ways try and reduce the stigma. I know we're going to talk about the listening campaign later, but within communities that often don't present early enough, or that seems to be one of the things that really hold people back, and understanding. And certainly people often tell Healthwatch as well that one of the issues is where to start and how to get help if you don't need, if you have if you need low-level mental health support. So where to start can be a real challenge. So I think anything that can be brought into place to support that. So the information around it, Emily mentioned the development of mental health champions, and understanding of people's anxieties and how depression and identifiers, all those things will help people really in the first instances.
Well, okay, thank you so much for that. We are coming up to time. It's remarkable how quickly we go. And I know Matthew will be joining us. He's just in the main room, so hopefully we'll have Matthew with us very shortly. But I was going to ask a question really to Al, if I can bring you in, which is that someone's asked us is how can community resilience be mobilised at a local level?
So thanks, Ranjit. That's an interesting question. I don't know if you can hear me. Can you? Yeah. Okay. Brilliant. I think that we've said that there's a lot been said already that's really interesting about what makes people vulnerable and how people can be lonely both when they're present with people as well as when they're alone. And resilience is the sort of the flip side to that. What makes people resilient when they're alone, but also when they're feeling lonely when they're with other people. And if we get under a little bit of what loneliness might mean, it might mean something like not being able to be your full self, not being able to have those opportunities to realize your potential. And I think that Nicola described that really well with her colleague who was a pianist. And I think that in terms of being able to access the kind of support that people need to really be their full selves, that sort of work starts with local communities. And there's been a lot of description already about how to harness the work that's going on in local communities, that those very nimble local relationships that people already have but probably need to be accentuated and supported, and then how to build backwards, if you like, through perhaps community champions to the sort of specialists providers like a mental health trust to enable those people who need that really sort of more intense support to be able to receive. So I think really this is about moving some of our resources upstream, about enabling those nimble local solutions with the fantastic work that is going on in very many communities to help people to be less lonely, to realize their full potential, both when they are on their own, but also when they're in those situations with other people where they feel thwarted or in some situations desperate and unable to be who they really are.
Al, thank you so much for that. I think, colleagues, what we're going to be doing in the chat function is posting up some of the questions that have been coming through, and we're going to take a break shortly. But so we'll make sure that we post those in the chat function. You can see the comments that are happening, but we'll also make sure that these are distributed far and wide. I want to ask one final question before. Actually, I do think we have to stick to time, so I won't ask the final question. So it's remarkable how quickly we run out of time. So what I was going to suggest now is if we take a 5-minute break, just stretch our legs. My colleague Dave is going to play a video of some local voices who are sharing why, in their experience, the work that's happening here is really important. Please don't go away anywhere. We will be back. We really want you to be engaged, and we'll continue to share the information that's coming through the chat function. I'm going to hand over to Dave, who's going to do some technical wizardry, and hopefully you'll be able to see and hear a video playing very shortly.
Can you see that?
Yes, we can see. I think you just need to press play, and hopefully the volume will come up. I don't think we can hear the sound, Dave. I think when you share your screen, you have to click the button that says audio as well.
I mean, physically, financially, in all of the way.
My entire life purpose of the last 2 years came crashing down in a matter of seconds with Boris Johnson's announcement about closing schools and cancelling exams in March. Young people lost their friends, their education, their futures, the people they confide in, their escape and their distraction from everyday life, all instantaneously, and were given just 2 days for some kind of closure.
I recently had a conversation with a young woman a black mom, single mom, has a 6-year-old son and lives in a house that she's been completely upset with. And I think what COVID has done in terms of my engagement with community groups, it really exacerbated pre-existing issues around housing, issues around poor access to mental health services and so forth and so on.
For me, good mental health is really all about how do we support people and families to retain a sense of well-being and positivity and optimism about the future, and that's going to vary enormously depending on individuals and their circumstances and the challenges that they're facing. And of course, it also has to mean being there when things feel just too difficult, too challenging, and when problems are starting to develop before they get so bad that they push people into crisis.
I'm supporting this program to protect our communities and mental health because COVID-19 pandemic brings all types of feelings, from loneliness, mood swings, anxiety. We all need somebody. Reach out to family, friends, people like us. We're here to help you.
Hi, I'm Ellie from PACT, and I am supporting this program to protect our community's mental health because the pandemic has exacerbated many of the challenges that were already being faced by families in our communities. This is a great opportunity to better understand how we can support the most vulnerable and enable them to access services that are relevant to them.
We're working together to help protect our communities during the pandemic. In this summit, we'll help to shape our vital plans.
Hi, I'm Priya. I work for the Maudsley charity. Good mental health to me is maintaining a balanced attitude, a balanced approach, not to get too swayed by what's happening outside, what's going on in the country, in the world. To think that we are all in this together and we have to get out of this together.
Hello, I'm Chris Best. I'm the Deputy Mayor for Lewisham and the Cabinet Member for Health and Adult Social Care. I've just been amazed at the work going into this programme. It is so important, and I believe that every resident should receive the help and support they need, and we must work together to make this a reality.
Hello, my name's Layla from PACT, and I'm supporting this project because I think good mental health is the cornerstone of a healthy society.
This summit is important because it brings stakeholders and communities across South London together to focus on promoting and protecting mental health, a topic which is often stigmatised. So giving people a chance to come together and not only openly discuss, but to have a say and help shape the future of mental health in their communities is something we should all be doing.
I find that hearing and reading about the way other people have navigated their way through mental difficulty and distress, as I do every day here at Bethlem Museum of the Mind, is really good for my own well-being.
Hi, my name's Millie and I'm from Parents and Communities Together, and I support this project because the first time we went into lockdown, we were just surviving and we forgot about key important things like mental health, and it's important that we don't do that now.
Brilliant, Colin. So I hope that you will be able to just take a few more minutes to stretch your legs, grab a cup of tea, and we will be back in 2 minutes. So don't go anywhere apart from to your kettle and back. See you very shortly. For people who are watching, you'll be able to see there's a remaining time that tells us how long we've got left in this breakout session. So you can see in the right hand corner we've got 32 minutes left. But we'll see you back here in 2 minutes. Right, hello everybody. We're going to be starting again in a second for our next breakout session. So if I can ask you to put your cameras on, if you're happy to be filmed, it'd be glorious to see you all. I was going to welcome Matthew Trainer, who's the Chief Executive of Oxleas NHS Foundation Trust and is a big supporter of this work and has done huge amounts of work across the system. And we're very grateful and delighted to have Matthew here. Matthew, if you're able to just share with us a little bit about, from your perspective as a Chief Executive, why you feel this work around social isolation, loneliness, and community resilience is important. Is that? And brilliant.
Can you hear me?
We can hear you, Matthew. Yeah, brilliant. And we can see you as well.
I've only just come into the room, Ranjit, so I haven't heard what's been said before. So are we talking about, tell me about the question again, sorry.
Yeah, sure, absolutely. So we were having, I know we were having some difficulty getting you in, so apologies for that. But the conversation we've been having really is around the impact of social isolation, loneliness and community involvement on people's mental well-being around COVID. And what we wanted to know, as your perspective as a Chief Executive, really what you think is important about mental health organisations getting involved in supporting communities who may not traditionally have mental health problems, but now may be facing mental health problems.
I mean, this year has been very tough, I think, for all of us. And I think, whether it's someone living with severe mental illness or someone whose mental health has suffered as a result of the pandemic. And it's been interesting talking to colleagues who I work with about the impact of things like having to work from home for a prolonged period of time. I mean, we've got some staff who've not been in the office now since March, or even just the disruption that having to work digitally in this way does. You don't have those natural opportunities just to come together as groups and discuss what you've been experiencing during the day. And they're the things that you do when you're experiencing stressful, difficult times. You want to let off steam with people. And I think whether we're talking about people who use our services or people who live in the communities of South East London, we're all experiencing these profound changes, both to the things that we do, whether that's work or other meaningful activities, those changes to the people that we get our support from those meaningful relationships, those encounters they have day to day, where you get that source of support. And I think it's a good opportunity for us as trusts to use some of that insight that we've got into how people respond to stress, the things that become protective factors around meaningful relationships, meaningful employment, a safe place to live, and how we can work with our communities to support our partners in local authorities, in primary care, and really importantly in the voluntary and community sectors to support people during this. So I think it's that sense that the experiences of the people that use our services and those that don't actually, is that all of us are finding this year tough. It's important to recognise it's been difficult, and really if you can find someone just to share that with, somebody just to say this is hard, this is a hard year for all of us. There is an end in sight. There'll be an end with the spring, which will bring about changes in the way that we can all get back to some of that relative normality we experienced in the summer. But also there's things like vaccines and more effective treatments for COVID coming over the horizon. So I suppose it's about recognising this isn't just about statutory services, about health services, about local government services. It's about all of us treating each other with dignity and respect, and on a very human level, recognising that 2020 has been a year unlike any other we've experienced, and it's okay to feel not okay this year. It doesn't mean you're not well, it doesn't mean you're ill, but it does mean actually you need somebody to talk to. And I'd encourage all of us to play our part in creating those space for those conversations about how hard this year's been.
Matthew, thank you so much for that. And I think many people watching and listening will relate to what you just said there, and I think it's really important that we've been able to hear that from yourself. Thank you, Matthew.
Thank you.
That leads us very nicely onto the next theme that we're going to focus on, which is helping people who are at risk of losing their jobs cope. And we're going to hear from Danielle, who is going to talk to us a little bit about her experience. Can I just check if Danielle is in the room?
Danielle's just having some trouble joining, Ranjit. I'm just going to call her now, and we might be able to get her to speak to the room via the phone.
Okay, all right, excellent, no problem at all. Danielle to join us. And we all know the impacts that this is happening, and even in my own family, both my brother and sister were impacted from this. They work in the airline industry, and that has a knock-on effect. But I'm going to ask Ed Davey, if I can, to talk a little bit about why this theme was important. And why this ambition came about in the way that it has. Ed, are you able to share your thoughts on that?
Right, I think Ed has also had some difficulty joining, so I think if we...
I did see Ed a few moments ago. That's fine. Let's see, now let's third time lucky. Carla, I know you're on the line. So, Carla, do you want to just share a little bit about your perspective about the work that the Taskforce did around the development of this ambition and why it's important?
There you go. Can people hear me? That's fine. I think it said the host had to kind of unmute me, so now I'm on mute. Hi, I'm Carla Faree, and I'm the Director for Social Care with SLAM. And with Ed Davies and others, we were looking at specifically how can we help people who are at risk of losing their jobs, and how can we help people kind of cope? As we know, there's a lot of studies out there that has shown the importance of having some kind of structured activity, whether that is formal employment or voluntary kind of structured activity in your life, how important that is for people. And we know that with COVID, it has had this tremendous impact, not just on the physical health side, but on people's socioeconomic kind of conditions as well. And a number of people, as we know, has gone on to kind of this extensive furlough scheme that is kind of funded through the government. But a lot of people are living in times of uncertainty around, whether they are going to still be in employment, whether they still will have a job after this. A number of people we know in small businesses have gone down under. So within this context, we looked at particular how can we in South London work together as kind of a bigger community, as a bigger system around how can we support people to cope with those kind of particular stresses around job losses, around maintaining your employment, etc. So what we've come up with, and I'll just quickly read the overall kind of objective, is to support our local economy in South London by working with major employers in the area to recruit and to buy local, and a commitment that we will work with partners to ensure that people who are at risk of losing their jobs or are currently unemployed to have access to high quality advice and support, and encouraging employers to adopt the London kind of best practice around London living wage. We also talked about the importance of big organisations like the NHS, local authorities, councils, and other kind of big institutions, which we refer to as anchor institutions. How can we assist and work with communities in our role, recognising our role in recruiting kind of local people? Business partners and businesses, small business, big business, around good HR practices. How do we work and raise that awareness around mental health and breaking down the stigma, and particularly within this context of COVID, people working remotely, people perhaps feeling much more isolated or feeling that they're putting in more hours working kind of remotely from home. And it's about how can we work kind of with the community and businesses and community to buy and recruit local people, and our role as anchor institutions within that. Yeah.
Fantastic, Carla. Thank you very much for that. And I think we are still waiting to get Ed hopefully back, who will then join us. We're seeing that people are posting questions, which is really fantastic.
Yeah.
I think on behalf of everybody, I think what we're saying is that through the listening campaign, it's a real opportunity to shape this program of work. Would that be fair to say, Carla, that it's through people getting involved, telling us what would work, how communities can support themselves, and what's needed from institutions?
Yeah. Absolutely. And again, I think that local focus is so important about how we, engage those local businesses, but also kind of the big kind of organizations. Like I said, how the public sector and organizations like the NHS is one of the largest kind of employers, how we can kind of assist, in that as well. And certainly for us and where we're in SLAM, we are kind of actively focusing on local recruitments for people, and how can we support and develop, and how do we work with others. But it's important that we hear from communities, from people around what initiatives are there, things that they are already receiving through employers where they perhaps are working, are the things that could be done differently during this time, our kind of culture of across the world of work, really.
Carla, thank you very much for that. I was going to now turn to Ada, who is a disability employment advisor at a local job centre. Ada, are you there? And are you able to talk a little bit about your experiences and potentially some of the work that we could do together? Ada, you might be on mute. Yeah.
Hi, it wasn't letting me unmute myself at first. Hi, my name is Aida. Yes, and I'm sort of normally based at Mitcham Job Centre, so I work in Merton. And I think in terms of mental health, we all know that was one of the questions that came up in one of the pre-summit questions about, you know, how important it is for our mental health to be in work. And like, as was said before, in some kind of, you know, engaging activity. But, you know, apart from the fact that also it gives, you know, that it gives us financial independence, it's just good to have the social contacts and to have purpose and meaning and so on. And I think it's important for people to realize that the job centre is not just somewhere where people should just go to claim benefits if they find themselves falling out of work or their business isn't earning what it was. Obviously, there's support for self-employed, but there are so many programs that have been started that we were working with before. So to support people with mental health conditions, we've got health related programs that give that specialist support into employment. But the government has also started quite quickly loads of initiatives to support especially young people. That's been a real focus because they've been most affected by the unemployment epidemic that we are experiencing. So the Kickstart scheme that helps it finances employers to take on young people. And we also signpost people to third sector organisations if they need any particular, you know, specialist support. So in terms of employers supporting people and recruiting people with mental health conditions, I think it's really important that employers show and demonstrate that they do provide a safe environment for people to talk about their mental health. In crises like these, people with mental health conditions are most likely to fall out of work and then find it more difficult to re-engage with the world of work. So I think it's really important that we do work with employers to ensure that managers are trained to deal and support staff who have mental health difficulties, you know, to think about their recruitment practices, you know, to have a duty of care, to invest in well-being and self-care. It also in their favor reduces, you know, absenteeism and increases productivity. It would be useful if more employers were providing more flexible working arrangements, making reasonable adjustments. And I think working with partner organizations, and I think generally speaking, I personally, with working in partnerships in my borough, find it frustrating sometimes when organisations don't engage with us enough, because we are able to support people who are unemployed more the more we engage with our partnering organisations and work together. So I don't know if anyone's got any questions, but there is a lot going on to support people who are unemployed at the moment.
Excellent, Ada. Ada, thank you so much for that. And I think many people will be reassured hearing that from you. And I think what we should also say is that we will be sharing information to those people who have attended after this event, where people can get support. And that's a really key component of the work that we're doing here. I'm going to bring in Ed Davey in a few moments, but before I do that, I'm going to just ask Millie Banerjee, if I could, just on her thoughts. And then I'll come to Matthew Trainer again. And then Ed, if you're able to kind of help us put into context this work, that would be really helpful. So Millie?
Yes, I want to just observe, Ranjit, listening to this very rich set of things that people are doing individually, locally, in different parts of the social environment, as it were. And I kind of wanted to put two challenges to the task force, really. One is, can we maybe put together a directory of what's going on so that we can access each other's good practice relatively simply and easily without making this something big? But at the other end of the scale, could I suggest to the task force that maybe what you could look at is areas of intervention which is giving the best possible outcomes and focusing on some, not all, and that doesn't stop all the local initiatives, but to put our strength behind it as a collective. Maybe we can actually help each other a lot more if we narrow down some of the initiatives that we want to focus in on. So that's just for something for the task force's members to think about, Ranjit. Thank you.
That's really helpful, Millie, and I think just seeing the rich dialogue that's taken place, and we will do our very best to respond to colleagues later on and provide some further updates on the questions. But there is certainly such a rich vein of work that's happening across South London, which is encouraging, but we'll certainly take that away. Thank you, Millie. Matthew, can I just come to yourself as Chief Executive of Oxleas NHS Foundation Trust on your views on what you've heard so far?
I think it's been great, Ranjit, to hear so much about the contribution from the sort of non-statutory sectors and from community organisations, voluntary organisations, and others. And it's really interesting seeing the debate about how we can let people know what's available there to support them. And I think ultimately for people who are living with longer-term mental health problems and living with severe mental illness, some of the real strength of recovery comes through developing tools yourself that can help you live with what is, in some cases, an enduring lifelong illness. And actually, it's not, if you become dependent on statutory services for your wellness, that's not a good place to be in, and that's different from things like medication and regular check-ins with people who can help you stay well. So there's something about developing people's own strengths and embedding those strengths in the community in which they live. And, for years, I worked for the Multiple Sclerosis Society with people living with MS. And, one of the greatest sources of support from people with MS was other people with MS and other friends and family. And talk to some of our service users who've set up service user networks and those kind of groups. They don't need Oxleas to tell them what to do. We can perhaps help them, give them some of the tools or the learning or the insight to inform them into what they can do. But, really, I'd like actually to see trusts like ourselves and SLAM and others be a bit more aggressive and take a few more risks in terms of using our assets to support communities to do things themselves, really. And this isn't at all about saying, we don't want to take responsibility for stuff that is our responsibility, but we are not the experts in how a lot of people who use our services or who struggle with their mental health live their lives. There's some real, the experts on this call, everyone on this call has a degree of expertise and leadership in this space. And we need to share that across our organisations and empower each other and empower the people that need our services to find that strength in themselves as well.
Matthew, I think again, many people will relate to what you just said there, and I think it's a rallying call for everybody who's joined this summit, who's in this breakout group, to be able to get involved and shape it. So thank you very much for that, Matthew. I think many people will welcome what you've said there. Can I turn to Ed Davey? Ed, you've been involved in the work around this theme. I know we couldn't have you earlier, but we're really glad that you're able to join us. Do you want to just tell us a little bit about the thoughts behind this theme and how it resonates with yourself?
Sure, thanks, Ranjit. I'm not going to turn on my camera because every time I do, I crash out, and I don't want to start that merry-go-round again. So I think you're stuck with my picture of me. Oh, it's chopped off the top of my head, so you can't see I'm bald, but my hair's grown back overnight.
But you're smiling. You're smiling.
Oh, that's good. That's me getting my degree last year. So that's a nice picture. Yeah, well, I've got some personal experience of this in the 2008 economic crash. I was made redundant, and then I've just been made redundant again in July. So I've had a bit too much practice at this, so I know firsthand what it's like for people in these circumstances and how stressful it can be, and not great for your mental health. And the first time in 2008, I sort of hit rock bottom of my pre-existing drink problem and drank myself into King's College Hospital, where I was fortunate that I had the love and support of my family and friends and really good medical help. And then I was an outpatient at the Lambeth Drug and Alcohol clinic, which is run in a consortium with South London and the Maudsley. So I've had a good experience of mental health services, and that helped me kind of rebuild my life. And I haven't had a drink since. So it's beginning to feel like an AA meeting now, which is not a bad thing. So I know the effect of these issues that a lot of people are experiencing at the moment, and how devastating it can be for people. And whilst I've had experience of mental ill health through substance misuse and depression, I'm sort of cautious always not to kind of over medicalize these things. Some people do have sort of health symptoms like I did and required medical treatment, like cognitive behavior therapy really helped me. I also took antidepressants. I found that useful, and I recognize it's important that people have access to professional evidence-based medical help. But we also have to think about the circumstances that support everyone, whether they have a diagnosis or not, to enjoy the best mental health. And part of that is around work. And I think about my own situation and other people's. If my employers had really good human resource approaches and ways of dealing with people sensitively, whether it's in a difficult process like redundancy or just general management, I think I would have got a better outcome on both of the occasions I've been made redundant. If employers had a better understanding of mental health and supporting general well-being of their employees, I'd have had a better outcome. And if I'm in the, you can see me there in my robes, but I appreciate that I'm in a very privileged position with my education and my white skin and my heterosexuality and my maleness and all of that, and that other people don't, through no fault of their own, possess those privileges. And we need to make sure that we support everybody to fulfill their potential by getting a decent education, training and living wage, at least employment opportunities. And we're in living wage week this week, and we got a new living wage. And one of the most useful things I did as a counsellor when I was doing the health portfolio, I'm doing the children's portfolio now, is support South London and the Maudsley and Guy's and St Thomas's Trust, NHS trusts, to get London living wage accredited, lifting hundreds of people out of poverty. So we can talk about medicine, and we can talk about counselling, and we can talk about this and that service and mental health awareness and all of that. But actually they're all important, and I'm not minimising them. But the circumstances in which people live and the environment we create for them is what drives ill health and good health. Poverty is the greatest driver of ill health, and all of our public sector employers in particular, but everybody, but there's lots of them represented in this summit, needs to get London Living Wage accredited with the trust. They need to have the right HR processes to support their employees and to procure goods and services from the local community, the private sector and the voluntary sector in particular. And if we did that, we'd be reaching a majority of, because those are the biggest employers, right? The NHS Trust, the councils, the universities, the schools. We'd be reaching a huge number of our local residents and setting a really good example to others in our community. So I would say let's make sure that the medical services are there when and where needed, and that they're evidence-based, of course. But our responsibility is also about creating the circumstances to enable people to enjoy fulfilling their potential and living their best lives, if I can put it that way, by creating the environment, decent housing, community facilities where people can meet each other when they're allowed to meet each other, that is. But also the jobs, training and education opportunities that are paid above poverty rates, so that people can make their own choices and live their best lives. So on this theme of helping people at risk of losing their jobs, we've concentrated on encouraging employers, particularly in the public sector, but not exclusively, to create living wage at least jobs and make sure they're supporting the local community by buying goods and services from local organisations. We've also said that advice for anyone at risk of losing their job or who is unemployed, advice on welfare, on their rights in terms of the benefits that they're eligible for, in terms of getting jobs and training and well-being, is available to everybody. And the third point is about good employer practice in terms of HR and wellbeing practice for those organisations. So those are the three things that we've sought to do. Really welcome any comments or questions that people have. Probably won't get around to answering them all in the 3 minutes, but we will capture them all and get back to people and try and incorporate ideas that people have in the next stages of this process. Thanks, Ranjit.
Ed, I think on behalf of everybody who's here today, just want to say thank you very much for being so honest and open and sharing your story. And I think it speaks to all of us about just how important this work is. And I guess we've spoken a lot about why this is important. Is there anything, Ed, you want to say about how people can get involved around this? And is there a view, in a sense, of how we can capture all the amazing work that's happening across the across South London? And Millie spoke about a directory of some sort. Is there some views on that, Ed, that you want to share?
Yeah, so firstly, I'd say, you know, like the most useful thing I think I ever did was help persuade and support our local NHS trust to get living wage accredited. And the Living Wage Trust is a kind of spin out from Citizens UK and South London Citizens, who are a part of this process. So I would encourage people to join them and support campaigns to get all of our employers, especially our big major public sector employers like the NHS trusts, councils, universities, schools, accredited. And it's important they're accredited because it then affects contracted workers as well as directly employed workers. So I would say that's one means of getting involved. Then on the directory, so this comes up a lot, and I've done work with Thrive London across even North London. I know it's terrible for this audience, but yeah, I've even done work in North London. And the thing that unites every borough, north or south of the river, is a desire to learn more about what's available. People are always surprised. Well, I didn't know X or Y existed. I didn't know the housing association did this. I didn't know the council did that. And everyone always asks for a directory, which is a really sensible request, but more complicated than you might imagine to fulfill. So because there's always organisations, especially smaller ones, that come in and out of business. And so it's quite a lot of work to maintain a directory. In Lambeth, we've commissioned Age UK, our local branch, to maintain a kind of map, and that's developing, and that's pretty good. And I'm not saying it's impossible, and I'm sure technology has an important part to play, kind of mapping this stuff. I know that technology isn't available and accessible to absolutely everybody, but I think that's part of the answer. But it's more complicated to deliver than you might think.
And brilliant, thank you so much, Ed. So you'll see, everybody, that there's we've come to the end of our session and we're about to go back. So thank you very much. We will provide responses to the questions later on. I'm glad that people could get involved, and we'll see you back in the main breakout session. Thank you very much, all our speakers, all our attendees.